Thank you, Mr. Chairman. Dr. Rubidoux, thank you for being here today as well. I spent a lot of time traveling across Montana in Indian country, and one of the concerns I hear within IHS is the administrative costs, where a lot of the expense occurs before the dollars actually get down to the people that need the help. About how much of IHS's costs are estimated to be administrative?
If you look at the overall budget, it's approximately 10%. And if you look at the area office budgets, it's equivalent, around 10 to 11% as well. And so most of really 90% of the funds are used for service units, for direct health care, for the services that we do provide. So I do know that tribes have that concern, and what we've been doing is putting together budgets to show them the actual numbers so they can see where that is. And the administrative portion of IHS actually has been decreasing over time as more tribes take their shares as they take over the management of the program. So I'd say on average about 10%.
Well, appreciate that, and be very willing to work with you all looking at how we can reduce the overhead and so the dollars are getting down to the people that need the help. And I appreciate the comments on self-determination as well. I think that's a direction we probably need to head. I hear that from our tribes as well. So we'd like to have more empowerment and control over those dollars to spend them closer to where the people actually are receiving the services. We had a recent article, in fact, in the Billings Gazette, a family that was in Ashland, Montana, and the contractions came. They're making a mad dash to Billings, came through the Lame Deer Clinic, but there were not facilities there for delivering babies. In fact, to quote the mama, she says, "We were flying all the way up from Ashland to Billings, and we almost made it." And when she says flying, it wasn't an airplane. They were going quickly there in an automobile. What kind of reforms do you believe are needed to ensure that the folks have access to these kind of services closer to home versus 2 and 3 hours away if you're driving fast and the roads are good?
Well, I completely understand what you're saying. When I was a doctor in the Indian Health Service, I delivered babies in the ambulance on the way to Globe, Arizona. I've delivered babies in a bathroom, and you know, it is such a challenge on the front lines in the Indian Health Service to meet the need with the available resources. However, especially in Montana, we've been talking with tribes, and there is a great focus on wanting to improve access to care. There have been a number of improvements that have been made by the acting director there, trying to expand access to services, have the clinics open more hours, and actually talk with tribes about priorities, given that we have a fixed budget for the amount of services we need to provide, and the need is great, trying to align how we spend that budget with tribal priorities. So, for example, at Crow and Northern Cheyenne, they've already done renovations for an OB unit, and they are looking for ways to find revenues to be able to support that service and the providers.
Appreciate that. We'll look forward to working with you on that as well, out there in the Crow and Northern Cheyenne, part of our state. Assistant Secretary Washburn, the Montana delegation has offered legislation to recognize the Little Shell tribe for several Congresses. We have our entire delegation on board introducing this legislation. I know you've been doing some work to reform the federal recognition process for tribes. How might these reforms help the Little Shell tribe?
You know, Senator, thank you for the question. It's a little bit premature for me to say, honestly. And the Little Shell have had a tough run of it in our process, and that process came to near completion. We know that Congress has every right to recognize tribes, and so, you know, we encourage your efforts over here too. And so I don't want to go on record just yet saying what we're going to do. We're working on that. We're still sifting through lots of comments and trying to figure out exactly what the new regulations ought to look like. We want it to be a very rigorous process, and it certainly is. And we know that there are other mechanisms for recognition, and Congress has recognized a lot of tribes over the last couple of decades, and that may be an appropriate route for Little Shell recognition.
Well, I know they've got stacks and stacks and stacks of paperwork as they move through the process over what's been decades, and if I could get your commitment, we work together, whether it's administratively or legislatively, to get that ball across the goal line.
We'd be delighted to work with you. Thank you, Senator Daines.
And maybe lastly, in terms of department's resources, how much of an impact would federally recognized the Little Shell tribe have on the BIA's budget?
You know, we don't actually look at that as part of our criteria, because if we have a federal trust responsibility to that tribe, if they ought to be a federally recognized tribe, then, you know, that shouldn't be a big part of our consideration. You know, we've got 566 tribes, so, you know, on balance, one additional tribe doesn't add a lot of marginal cost, usually. I don't know what the specific numbers would be with regard to Little Shell.
Okay, thanks, Secretary Washburn.
Thank you.
Thank you, Senator Daines.